Hello, Lynn. Well, from my point of view, insurance sucks. And I think it's legalized gambling. You're gambling on your health. Are you going to need the insurance? Sooner or later. The more you pay in, the more less it's worth for you. It's like the odds. I go to the casino, I put a bet down on the craps table, and say it's one of those one roll at a time and it pays so much to one. Unless it hits in a certain time frame, it was a waste of my money. And for many people, it is a waste of money. But believe it or not, your money that you go in helps cover the other people that do get sick. It's one big system, a big slush fund of money. Everybody putting their money in, betting that they're gonna need it, need the insurance, gonna need the coverage. And you know what? For a lot of people who have kids and wives, they need it. Kids get sick more early, colds, flus, checkups, shots. Wives have to bear kids and the doctor bills from having kids. It really, having a family can be expensive. And let's just say I'm single. I'm 31 years old. I've only been in the hospital for something serious once. I have not been on any prescription drugs my whole life. They prescribed some things to me, painkillers, when I was in the hospital for broken bones. Oh, you need a painkiller, and they prescribed it to me. And they insisted when I was a kid that my dad buy it. And he was fully covered under insurance, so they got it. And I would never take the painkillers. I never took anything stronger than aspirin as far as painkillers go. Really, to be honest, it's nuts. It's wrong, and it has driven costs up. Because when people stop worrying about how much it costs them, then the prices get pushed because, well, someone else is paying for it. I can just go and see the doctor for no good reason. And sometimes it's good, it's precautionary. But you know what? You don't know. When you don't know what things cost, it's easier to have high, crazy rates. I think they should have a big board up there, much like when you go into Subway or McDonald's, that says the price of a hamburger or price of a sub. Would you like extra ham with that? Well, you should have a thing that says, well, how much it costs per hour with a doctor, how much they charge for x-rays, how much they charge for this or that. Because, believe it or not, I went into the hospital, and the insurance company had been billed, workman's comp was supposed to be billed for an injury I had. Now, due to the paperwork, there was a glitch, and I got the bill. Now, the bill was X amount of dollars. Workman's comp. And they said I had to pay $150 for the quick visit to the emergency room. Well, I figured it should have been covered under my workman's comp, not under my other insurance. Well, turns out I found out a little dirty secret. When they billed me $150, they figured they were just billing an individual. So it only costs $150 to me. Well, when I went to the insurance company, they charged them $600. That's right, $600. That's what the insurance company paid out. That's right, they paid out $600. Somehow, it cost them more for the things than it did for me, which I didn't quite understand. But anyway, it would be, and this is something we need, because there's a big curtain over the whole system. You can't see how much things cost. You don't see it. The insurance companies get billed it. Then you see it when you don't have insurance, and you're like, oh my god, it's so expensive. And the real problem is that the supply is limited, the demand is always high, and it drives prices up. So insurance, believe it or not, actually increases the demand, because when people don't have to pay it out of their own pocket, they're more likely to go see the doctor. Now this is good, you say, people, because people will be living longer lives. But the negative drawback is that someone's getting rich, because the odds of you getting sick only increase when you get older. And insurance companies are more likely to drop you like a bad habit when you have conditions that already exist. They use them as excuses. Why? Because it's about making money. It's not about giving you health care. Too many people confuse with health insurance with the right to health care. Health care is a right. Everybody should be entitled to see a doctor. If something's wrong with you, you should be able to see a doctor. Now, I had one guy say to me that his doctor that he had for 20 years refused to see him and treat him because his health insurance was gone from the previous company. He told him that only one of them, he'd only look into one thing for him. He couldn't do the x-rays because he was scared he wasn't going to get paid. And I said to him, why didn't you just ask him, how much does it cost for these x-rays? I'll pay up front. And I wish that for some people that can afford it, they'd have that option. But, oh, you don't have insurance? Well, I've seen a guy deny coverage for not having insurance because the doctor was scared. And you know what? They never talked about what it would cost him. And that, to me, it's like you get insurance, you have insurance, or you don't have insurance. But there should be the right to know how much, and I'm sure there is the right to know how much it costs. But they should have it right out there in the open, where you can see it. And that's the illusion I see. Health insurance has covered people's eyes to the fact that costs will keep going up and up, because the real problem is there's a huge demand for health care, and we do not have a big enough supply of doctors and nurses, and we need more. And that's what we need to focus on, because even if everybody's covered, if there's not enough to go around, then not everybody's going to see a doctor or be able to, and that's another problem. Well, single payer, we have it under Medicare, we have it for the VA. What we really need, more quality doctors, quality nurses. We do not need to push them out. Here's to all the doctors. You work hard, and you're hardworking. And down with the insurance companies that are the business side. I know, the dirty business side about making money. And believe it or not, now the big hospitals are tied in together. They're knitted like this. It's become a money system. Because I'm going to be the first to admit it. By nature, people are greedy. Greed is the dirty thing that drives too many people. Good day.